NAPWA supports the maintenance of a national positive women's network, and it's really vital in Australia because positive women only make up about 10% of the positive population, so we're often considered invisible or hard to reach, whereas we know globally women are over 50% of the positive population. So it's really important, we think, to have a national women's network to challenge this perception and to share our political knowledge, skills and experiences, and so we can inform national debate and decision-making processes. Now you have to listen really carefully. I'm just going to play a few minutes of a CD.
I know a woman with a sad story to tell, who finds her inner strength by acknowledging that a balance can be found. Sadness and grief, and joy, great joy, and she thanks the universe. She is grateful for big and small miracles. She shares her story as a means of educating and demystifying this disease in her body, in her blood. It could be cancer. Is that what you're thinking? Anything else? But no, it's HIV or AIDS. How did she get it? Why do you ask? She doesn't know. But it's how she deals with it that counts. Not long after diagnosis, 20 years ago, she was visualising her virus, a strange amoeba-like creature, a distorted love heart symbol. She began a conversation with it, and it spoke back to her. They made a truce, and ever since they have had an amicable arrangement. It's not a he or a she, but it's living inside of her body, trying to exist as she is. It knows and sings all the songs of her life.
Under the NAPWA Terms of Reference, we've got 3 levels of membership. The first one is Women at NAPWA, so that's the National Policy and Advisory Group, and sometimes you may hear that referred to as Femme Fatales. It's a forum for issues relevant to positive women, and it enables collaboration between our policy and advocacy work. The second membership or sort of network is the broader email loop, which we call AusPos. We've got approximately 40 women who are positive women who are registered on that network, and we support an email list where we provide information exchange, peer support, discuss issues. We used it, for example, to promote Futures 5, and send out, just women-specific information. And the third network is the one that supports workers that support and advocate and work collaboratively with either women's projects or organisations. At the March face-to-face meeting, we had very robust discussion and exciting debate, as Jo will recall, and we identified 5 issues, and these are in no order of priority. The first one was stigma and discrimination. We wanted to make sure we'd heard about the national campaign that AFAO were doing, and while we knew that it was flagged the first phase with gay men, we wanted to make sure that women were a part of that campaign, so that happened, which is great. The second issue is disclosure. We've had extensive input into campaigns that Positive Lives have run. So through the network, they've used the Women at NAPWA network anytime they want information or want us to focus test a resource. We work with the health promotion team there on some of their campaigns, especially the one on disclosure. The third issue the network chose was sexual and reproductive health. And our big focus there was around what we call femidom, or the female condom. I was fortunate, Jo and I went to a national meeting at UNIFEM, and they asked me to present at a forum they were holding for young women. It was called Reversing the Spread of HIV/AIDS, and at that forum we used the opportunity to do a survey of 100 young women of what did they know about the female condom, and there was only about 6 women who'd even heard of a female condom. And the reason, so that's one of the things that you'll be hearing a lot about. And if anyone would like to have a look at one, I do have one in my bag. And that was really, there were several reasons for that. One was because there hadn't been a lot of success with microbiocides. STIs were increasing, and there was a lot of unintended pregnancies with young women. And of course, I think most people would have seen our PL article, Give Your Vagina a Choice. So I hope you all read that. The next issue that we chose was peer support, obviously because we're a peer support network. And so what we did was increase the contact that we had across our email network, because we knew that we had like 40 members, but it was about in getting those members to engage, because we didn't know, necessarily who everyone was. So what we did was, I think Beck's in the room yet. Beck and I kind of put out some bios about ourselves and tried to get some dialogue happening, and we're still working on that. I also went to visit the PLC here, located here, that have the ACON staff there, and they have the Women and Families project there, and I met with a group of positive women there, and they were really excited and interested in hearing about the work of the Women at NAPWA's network, especially the female condoms. Everyone's really interested in them. And the fifth issue that we talked about was capacity building, and we talked about, well, in order to do that we should have a skills audit. We needed to know what were the skills that we had across the network, and so we're working on that as well. And we wanted to increase the promotion of the members and the skills they had, and as I said, we had PL articles, and we also upped the information that we had on the women's page on the website. Thanks, Paul. And the website being launched with the living, treating and defeating. So there's a lot more links, and we've got things like common threads and songs on the blood, and so it's increased that opportunity for networking opportunities. So finally, some of the highlights and achievements. The first one, we're increasing the profile and visibility of the network, so that's been one of our achievements. We've had presentations at conferences. John mentioned earlier, a couple of the women did presentations at the New Zealand Pan-Pacific Gathering, and a couple of other women, I think it was Beck and Kim did a paper, and Susan did a paper at ICAP. Sharon also presented Songs in the Blood at ICAP. We've resource focus tested a lot of stuff. Fact sheets for family planning. There was Unravelling the Law, a legal resource that the HIV Legal Centre did here. We had input into that. And also there was the health promotion team at Positive Lives did a Quit Smoking and Living with HIV and Cancer, and we also contributed to that. I suppose the biggest piece of work that we did, with assistance from Jo and also Kate, we did a submission to the Commonwealth Government's National Women's Health Policy paper. It was a huge chunk of work, and one of the exciting outcomes of that was that when they did the consultations around each state, when they came to South Australia, I was able to be really vocal and insist that one of the population groups that be named, they had about 15 population groups, and I insisted that positive and affected women be named, and that got up, so I was really pleased about that. And the reason we contributed that was we wanted to focus on the needs, because the Women's Health paper is focusing on the needs of marginalised women who are vulnerable and at greatest risk, and that's where positive women fit into, so that's why we contributed. And it also was another opportunity to increase the profile of our network. Basically, I suppose it's because women's health is inseparable from the realities in which we all live in as women. So we've got a lot more work to do, and we plan on remaining an active and integral part of the national response to HIV. And the final slide is just something I always end with. It's a quote from the International Community of Women. Listen to our voices, learn about our lives, and consider our ideas. Thank you.